Well, good evening and welcome to tonight's webinar from the digital health team at the Western New South Wales Primary Health Network. As usual, I'm joined by my colleague Lisa Bose, and tonight's webinar is about Provider Connect Australia, a guide for registration and use. We'll get started with some housekeeping. You can type any questions you have in the chat box and we'll try and address them at the end as best as we possibly can. Everyone is on mute, and this session is being recorded and will be made available on demand on the Western New South Wales PHN website and our YouTube channel. But of course, I would formally like to start tonight's webinar by acknowledging the traditional owners and custodians of the lands on which we all meet tonight. I'm recording tonight's webinar on Wiradjuri land, and pay respects to all elders, First Nations people, and acknowledge elders past, present, and emerging, and recognise their continuing connection to land, water, culture, and community. And I extend that respect and warmly welcome all Aboriginal and Torres Strait Islander Australians who are present here tonight. So thank you for joining us. I'd like to just focus a little bit before we get into tonight's webinar on what will be covered and what won't be covered. And what will be covered is a general overview of Provider Connect Australia, what it is, its benefits, how to log in and register your organisation, including making the Australian Digital Health Agency, or ADHA, a contracted service provider via HPOS, which is a critical process to streamline the registration workflow. Setting up your business locations, healthcare services and practitioners in PCA, and of course, publishing or sharing that information with business partners. Now, what's not covered specifically is if you're listening to this, joining us, and you don't have an individual Proto account, or you haven't registered your business as a seed organisation with the HI service yet, this webinar is not necessarily for you. There's more work to be done. There's other steps to be done earlier before you register. So this webinar really is for healthcare providers who already have an active individual Proto account and a seed organisation is registered via Health Professionals Online Service, or HPOS. And you already understand too the roles and responsibilities and officers are assigned. So your responsible officer, or RO, and organisation maintenance officer are determined and well understood. So we'll not address in detail this webinar. We won't go into the healthcare identifier service process on how to register a seed organisation and that kind of stuff. I'll talk about what the HI service is specifically and why it's critical in the PCA registration process. We won't go through the process of identifying and establishing a responsible officer, or OMO, and we won't go through the process to register for an individual Proto account either. So there's a fair few things that we won't go through specifically today, but this will give you a very detailed look at, assuming you're ready, you've got a HPIO for the organisation, you know who your RO and OMO are, and now we're ready. We've got an individual Proto account, and now we're ready to register in PCA. So let's just have a quick summary of the learning outcomes to be really quick. We're going to recognise what Provider Connect Australia is, its core features, and how it benefits health system information exchange. How to register an organisation on the platform, how to create and manage information as it changes, and how to share information with business partners. And we'll talk a lot about how that exchange of information, how it works and functions, especially in relation to the National Health Services Directory and Health Direct Online, and what role PCA plays in that. So without further ado, let's get into it. Let's go into a lot more detail now on Provider Connect Australia. And what is it? So it's an initiative of the Australian Digital Health Agency, and is also known as PCA. And from this slide onwards, I will refer to it as PCA. Now, it connects providers with their business partners. It streamlines registration and ongoing updates of business information, and enables healthcare providers to maintain their details in one place. So in short, it's set it up once and share to many. It's a system that allows you to maintain record, and then conveniently share with as many partners that you do business with. So I talked earlier about the exchange of information, and at the centre, PCA is supporting digital health interoperability. So we can't achieve interoperability unless we have something that allows us to exchange and share information from a central source. So the healthcare interoperability, supports safe, secure, efficient, and quality care. It involves an ecosystem of connected providers that conveniently and seamlessly shares high-quality data with easily understood meaning throughout the health system. So PCA supports interoperability by synchronizing validated information across the healthcare system. And this will become relevant when we start to link information you may already have on the health services directory and you want to sync it back. Same goes with collecting information from the HI service that's already stored in trust and referencing it back. And a single source of truth about healthcare provider services and the practitioners that provide them. So how does it work? This diagram has been around for quite some time. And so let's now go into some of the details. So starting on the left with a healthcare provider organisation. So when they want to update some of the information we've talked about, so location, service details, practitioners that deliver on the services. So rather than having to tell multiple business partners, I could do it once in PCA. So then we move to the right. And not only does PCA store and share this information, it verifies it. It's a trusted source of verification. Verifies it by cross-referencing the Australian Business Register to validate ABNs. We use ABN information with APRA and the HI service, which verifies a practitioner's HPII, for example, and organisations in real time. And then we move to the right. Once that information is verified by PCA, it then allows you, the manager of that information, the author, to choose which business partners do I want to share that with. And it automatically does it for you. So set and forget. All you need to focus on from that day on in is just, do I have the right practitioners? Do I have the right services, the right location? So for example, as you expand your healthcare business, you could launch into another location. Then you simply add that location. If the services change, add new services. And because you've automatically set a flag to publish, you don't have to think about, who do I need to publish to again? PCA takes care of that for you because you set that up from the get-go. And it currently shares information from around 4,000 healthcare locations with 41 business partners at present, quickly growing. So what are the benefits? So it reduces duplication, less forms to complete, and all business partners receive the information at the same time. Saves time, reduces the amount of follow-up, redirecting messages, information received in error, that sort of thing. Streamlines processes for you, so it supports the automatic pre-filling, and this is something that we'll talk about a lot moving forward. You'll notice as we go through the step-by-steps, there's very limited free texting. Okay, it's trying to use existing information across systems where possible to avoid duplication error. Improved awareness. So complete and up-to-date listings of services in directories. So it's that ARM linking those directories so that we have that single source of truth as mentioned. So as an organization, you may have one location or many, as I said, and at each location you enter all the details relevant to that location plus what healthcare services are provided at that location if required. Who is providing those services? That's your practitioners. So note too that you are able to import existing location healthcare service listings from the National Health Services Directory to save on that manual data entry, and we'll cover that shortly in a lot more detail. So how does PCA ensure security and data quality? This is obviously quite critical. So as I said, we limit free text fields from users adding information to the PCA system. A robust audit log where the PCA system records, very similar to my health record, right? Who and when records have been created or modified. Using PRODA, so again, that authentication portal that's already well established to prove who's who can access. To be granted, of course, a PRODA account, the user must provide proof of identity. So you've got all those security checks and measures at the point, which is why you need that individual PRODA account before you get started. So let's just talk a little bit more detail. So for anyone listening, and maybe you're from the allied health sector, or perhaps a specialist who hasn't connected yet, or any of those healthcare services where you haven't made that relationship connection, then I'll talk a little bit about what the HI service is and why it's actually quite important in linking everything together as a source of truth. So the healthcare identifiers, also referred to as the HI service, is a national system for uniquely identifying healthcare providers, healthcare organisations and individuals receiving healthcare. The HI service is a foundational component of all national digital health products and services. So look, the best way I can explain it, and this is why when you register a seed organisation with HPOS, and in return you get a HPIO number, so that number is unique to you and can't be owned by anyone else, and it identifies you digitally across the system. So it allows healthcare providers to view a person's information, right, by using a healthcare identifier. So it's a digital tag, right? Assigns and administers healthcare identifiers. It connects the right information with the right individual at the point of care. Improves safety for patients, increases efficiency for healthcare providers. And anyone receiving healthcare in Australia can be assigned a healthcare identifier as well. Now, any healthcare organisation and healthcare provider needs to be uniquely identified through the HI system in order to access digital health tools, including PCA. So the use of the HI system also gives confidence that the right information is being associated, which may be a healthcare organisation or an individual. Now, there is further useful information available on the Services Australia website, and I highly encourage you, if you haven't registered yet, that's the best place to start. If your organisation provides healthcare services, you need to register it. This is the critical point. You need to register it to use and have access, okay, to use the HI service before you can view healthcare identifiers for patients. So this is things like the patient's IHI, Medicare details, organisations and healthcare providers, make referrals and send secure messages to organisations or healthcare providers, view and upload information to patients' My Health records, send electronic prescriptions to patients, and last, but of course not least, in the context of tonight's webinar, it's to register for PCA. So to sign up for PCA, you will need healthcare identifiers from the service. The HI service is the system that provides a consistent set of identifiers for healthcare individuals and organisations. So healthcare organisations need to be uniquely identified through the system to access digital health tools, including My Health Record, etc. So the use of the identifiers gives confidence, clarification that the right information is being associated with the right organisation and the right individual. So as I said, the HPIO is a unique identifier that is associated with a healthcare organisation. So the O, the dash O, stands for the organisations. All right, so healthcare provider identifier organisation. And the process is also known, and you'll see it referred later, as registering your seed organisation. Okay, so same thing. Now the HPII refers to the individual. So it's dash I, it's a healthcare provider individual. This helps separate the doctors,
GPs, the specialists, the allied health professional from the nurse, okay, as individual practitioners. Now, all AHPRA registered clinicians will have their own unique identifier, and they can seek that. If you're AHPRA registered, you can obtain your HPII from AHPRA. Now, non-AHPRA registered clinicians can apply to receive an identifier through the HI service platform on Health Professionals Online Service, or HPOS, or via their eligible professional body. Now, we're going to be doing some digital uplift education to the allied health sector in our local area a little bit later this year, but this is why it's so important, especially for allied health professionals with non-AHPRA registered, that you can still gain access. You can still have access to the HI service, but your path to registering is slightly different. Okay, so registering for Provider Connect Australia. Let's put some meat on the bones. So the steps for registering: pre-registration, and then the registration itself. So as I mentioned before, who is your responsible officer, organisation, or maintenance officer? Now, the other way to look at this, by the way, is you'll see as we get into the registration process is the management of data in PCA can be delegated by the owner or directors of the business itself. So whoever's names are associated, linked to the organisation with the Australian Business Register, they are the owners of the organisation. They themselves can control and access PCA to manage the information, or that can be delegated to administration support staff to do that work for the organisation. And so that's why understanding these particular roles is important, because an organisation maintenance officer is that very person that can do a lot of the heavy lifting in the administration space. So ensure that these people, for example, within the organisation, have an individual or pro account, and you've linked them. You need to register the seed organisation, if not done already, and link the Australian Digital Health Agency as a contracted service provider, or CSP, in your under your HPIO listing in HPOS, and I'll talk through those steps in a sec. Now, in terms of PCA registration steps, you access PCA either via PRODA or using a link, a URL web link. So there's two ways to get access, and follow the on-screen workflow to complete the registration, which we'll kick into right now. Now, after doing all that, step one is we need to go into PRODA HPOS, and we need to make the Australian Digital Health Agency a contracted service provider. So if your organisation wants to include healthcare identifiers, so it's the HPIO, the information you publish to business partners, you need to make the agency, so when I say the agency, the ADHA, who is responsible for PCA, a contracted service provider for your organisation in PRODA, and that can be done by the RO or OMO of the organisation. So I'm going to walk through this very quickly. I'm not going to labour the point. For those, like I said earlier in the introduction, it's expected that you already have a PRODA account. You will be very knowledgeable about these sort of steps. So step one, log into PRODA as you would. Go straight to service in the HPOS tile. Now click on no organisation, proceed as individual entity. Remember, we're talking about going into your seed organisation listing, and so no organisation, not the organisation name. I'm going to click on My Programs, and then over to the far right, remember we have healthcare identifiers and My Health Record. That's that universal tile, click on that. We want to go to Manage Existing. So again, the assumption here is you've already set up a seed organisation, so it's already here. So healthcare identifiers, Manage Existing Records. You then should see the name of your organisation. Okay, in this demonstration, we've got community pharmacy name, for example. It could be general practice name, etc. So you click on that, and then you come to more options here regarding the details that underpin it. And this is where you add who the OMO is, confirm responsible officer details. You can also, for example, for general practices in the room, it's where you go to apply for and manage your NASH certificate for linking your clinical software, things like that.
So we're going to click on My Organisation Details. And hopefully, again, this will look familiar. You're going to notice this tab on the second from the right. It's called CSP Links. We're going to click on that tab. And then hidden there, just below, you're going to see Manage CSP Links. It's a blue text link. You click on that. We then click on Add. And I'm just going to freeze on here so you can look at the number. But again, all this information is available on the Australian Digital Health Agency website in the registration steps. You can find the agency's HPIO number. That's what the agency has, is their own HPIO number. And you simply type in that number. It's the 800-36 number. You type that in, you click Submit. And then it will hopefully confirm that that number you want to check to make sure, because in case you made a typo, you want to check that it comes back saying that number belongs to the Australian Digital Health Agency, and then you click Confirm. And then hopefully you should see now that you've linked the agency, and that's linked under your HPIO. Now, select the HPD tab and check the Publish to PDS column. This should generally be yes, but it's just worthwhile checking. It's a good process. So make sure that that Publish to PDS is flagged as yes. If no, then select to amend and change it. All right, so that's been done in HPOS. That was step, I know it's presented as step 4 and step 5 in this context, because in early versions of this presentation, we had set up individual Proda account as some of the initial steps. But really, step 1, add CSP link, and now we're going to log into PCA and start off the registration process for the first time. All right, now it's recommended that before you kick off registration process, have ready, especially if you're the OMO and this has already been delegated internally within your organisational structure by the owners of the organisation, the directors. Have ready your organisation's ABN, the location details for your organisation, the contact details, so telephone number, fax number, email address, that sort of stuff. Now you can use the same or different email for legal notices, and you'll see where that comes up in the form submission. And the HPIO number of the seed organisation. Now, in the previous steps where we went through that, you can actually click and obtain that number at that particular point. So grab the HPIO number if you don't have it stored somewhere, and have it ready to go. All right, so we're simply going to log. We're going to log into Proda, and on the services landing page, you scroll down to the very bottom. Unfortunately, it's right down the very bottom, and you'll notice the tile there. Provider Connect Australia. Now you can you simply click the Manage button, click on the PHN name, one of the PO icons, copy the referral link. So this is the alternative website link. Is you can access the website by that way as well. Now if you do via the website link, then of course Proda, being the authenticator, will pop up and ask you to log in with Proda. If you're already logged in Proda within your web browser, that should already recognize and go straight to it. Okay, so this is what happens when you arrive. The screen off to the right there, welcome to Provider Connect Australia. And at the top right, you'll see login. And you log in, like I said, Proda will come up, and then you're in. Now, the first time you log in, the Proda Terms and Conditions page will appear. So once the information below is completed and saved, your profile will be added to PCA. You will receive a validation email with a link. Click the link to validate your email. Just remember the safety and security, right? So we want to make sure the system's always checking and proofing that the correct person is the one that's going to be responsible for managing the data. Okay, so let's go through the workflow in detail. Once you're logged in, you'll come up with this screen, register an organisation. So you got manage businesses or register a business. So you're going to be a first-time user, you're going to be registering a business. And you'll notice, by the way, on the top right-hand corner, it's got your individual profile already linked. So it's recognising that's you as author for this session. So register the business. It will remind you before you start all the stuff we talked about. You notice there it's got the ABN, phone number, etc. Trust and trustee name if applicable. So think about the details of the ownership structure of the business. and then click the Start button to begin the process. And what's lovely about PCA is they've developed a very sophisticated step-by-step WYSIWYG, if people remember that acronym, of stepping you through. So you don't have to think about, what do I click on next? It's going to prompt you at every step along the way. So you don't need to overthink. Just follow the WYSIWYG editor process and you won't go wrong. So the first it's going to ask you is, does your business provide healthcare to individuals? Simple yes or no answer. Let's click yes. Now, identify your business. Remember before we added the agency as a contracted service provider. And this is critical in terms of speeding up and making sure all the information is accurate from the get-go. So we want to click yes. We've done that. Identify your business. So this is where you type in the HPAO that you would have had ready to go. And there's a lookup feature. Remember I told you PCA is connected to the HI service. So by typing in and looking it up, it's going to already verify or validate, sorry is the word I should be using. It's going to validate that yes, no typos, and then it'll come up and it'll say, yep, it'll come up with a green tick. I'll say, yep, this is the business attached to that HPIO. So now we're going to add some quick details. Very simple: telephone, fax, if relevant, email address, and then a website if you have a website for the public to access as well. Again, they're optionals. You can see like normal web forms, we have a little asterisk which indicates they're the mandatory fields. The others are optional extras, if relevant. Now we're going to add address. Now just a little note about the address feature. My recommendation is to use the search, let the system, so start typing, it'll come up with a little drop down. You need to pay attention to the screen. It'll recognize and say, yep, we recognize this address. If it's not recognizing the address and the number sequences, then you need to click over here and enter postal address manually. But I recommend you try the automatic feature first because it will make life a little bit easier as you go through the system. So there it is, right? Start typing, it'll come up with the best option. In this case, yep, it's found 1 Eagle Street, Brisbane City. So we simply select that. Now, it's going to now move to the final step here, and this is the participation agreement. So this is where it's going to specifically ask you as the individual who's in PCA registering the organisation the first time, what particular role are you in this particular organisation? So we'll say the participation agreement for, it'll say the legal name of the business, the one that was registered on the Australian Business Register, hence the ABN reference. And it's going to ask you, right, who will accept the participation agreement? Myself. I will invite another person to log in and accept. I will get someone else to manually sign. So if you've been delegated, you can do yourself, but just note, it says there, based on your organization's legal structure or company, your participation agreement needs to be accepted by director or secretary, or if you've been delegated the authority, you may accept the participation agreement with a statutory declaration. So if you click myself, right, it'll come up with all that information. So myself. Now select signing role. So it'll then say, well, what's your role in the hierarchy? And you simply select delegated authority if it's a delegated task. If you're the director, select director. Okay. And then it's going to ask for your full name, title, that sort of thing. And then you'll notice it'll then come up with a document for you to download and sign. Okay, so you're going to need to download. Okay, then once done, once you signed it, got it witnessed, make sure you fill it out properly. You then need to upload a PDF copy of that. And this is an example, a sample of what you need to pay attention to. So full name and details, the name of the organisation. Make sure it matches that of the ABN of what's registered with the Australian Business Register. So signature of, and then of course, mandatory witness. And this should be someone within the organisation, say a nurse, another GP, that sort of thing. Now, in terms of the declaration, you've also got other information there you need to read and cite. So you're acting on behalf of, so this is just a declaration, you're acting on behalf of the organisation and the information's being stored and looked after by the agency on your behalf. So once you've uploaded it, okay, you can then move to next.
And then there's the participation agreement. Now, I'd recommend you, again, take the time to read it. Effectively, it's an agreement that you're authorising the Australian Digital Health Agency to act on your behalf. You're using their tool, their system, in order to share information with others. So it goes into a lot of detail about how the Australian Digital Health Agency is storing that information and looking after it, that kind of thing. So if you've read, acknowledge that you've read, and select agree. Now, once that's done, once it's all been confirmed, we get a lot more tiles pop up. And that's because now we're going to step through the WYSIWYG process. It's going to go, right, we're going to look at what services, we're going to look at locations, and then we're going to look at practitioners and everything else. So now registration is automatically approved if the practice manager or business manager is an authorised contact, right, as per the ABR records or an organisation maintenance officer for the organisation. If not, then, and you didn't add CSP links at the start, for example, then there will be a 24, 48-hour delay for the agency to review the documentation and then give the green light to proceed. So just bear that in mind. You may not get instant acceptance, but if you've gone through the steps properly, then it should be instantaneously. Okay, so now we're going to create and manage information in a lot more detail. Now, I just want to pause here for a second, because if you're a healthcare provider and you've already registered your service and locations on the National Health Services Directory or with Health Direct online directory, and you know it's there for public consumption online, then you've got the option to import that. And that's important, because if it's already there, it's important to import what's already there, because it will pre-fill a lot of the fields, make this whole process faster for you. And then you can use PCA to correct or update information, and then be able to push that back to the NHSD as well. So remember that PCA is that central source. So what you're doing is you're taking what's already out there in the public domain, pulling it, and then pushing it. So add locations to PCA, add healthcare services, and add practitioners is what we're going to go through. So first step, importing services if this applies to you, right? So now, some of you, if you're general practitioners listening in on this recently, so GPs across Western and Far West New South Wales were recently contacted actually by New South Wales Health requesting they update their information currently advertised on the National Health Services Directory, because the New South Wales Health, their directory, they use the information from what's published on the National Health Services Directory. So if it's incorrect at the National Health Services Directory, then they get the wrong information. And this is important for discharge summaries and things like that. So they did a bit of an audit, and around over 40% of the GPs in the Western and Far West, the information was out of date and incorrect. So this is why it's very, very important, and that's why that letter went out asking all general practices to please update the information. And that's why that letter talked about PCA as an option for you to go in and start to manage that. So centralizing it into PCA is recommended. So when you get to this point, straight off the back, at the top row there, you can click on import. So you click on the button, you simply follow the prompts in the form. Again, follow the steps. So enter the suburb postcode. Now you can only import healthcare services from one location at a time. So a little important caveat here, of course, if you're part of a larger network organization and you've been delegated authority to register lots and lots of locations under a corporate group, say, then this is going to take a while, right? You've got to think of every individual location, especially if you're responsible for managing multiple locations in PCA. So one at a time, you can't do bulk import, I'm afraid. So again, start typing in the details, and if it's already, and this is the clue, right? If you're already registered and you start typing in the name of this of the business, then it should show up. If it actually doesn't show up, that means you're not registered. You don't have any details published with the National Health Services Directory, in which case you can ignore this entire section and you just register the business from the other steps, which we'll go through in a sec. But that's a good clue as to check. Okay, So, and this happened not so long ago with a small general practice in our region where we started here. They thought that they were registered. When we did a search for all kinds of names associated, nothing was there. So we started from scratch. Okay, so it'll come up with the business, and just down below, you'll notice there, imported, not yet. But what you can do is, where in PCA should the services import to? So if you have a change in name, okay, you can certainly indicate down here. Now, this particular point is going to say who you would like to publish to. So this is that set and forget flag, okay? So Health Connect Australia, provider directory, the National Health Services Directory, providers and consumers, and provider or providers only. So the defaults, what you see on the screen is the default, all right? But you can choose either one, but the default is both providers and consumers will be updated. Okay, so then make sure you read and agree to all the information use statements above, and then click import now. It'll then come up with a green tick, hopefully. And remember, you've got to do this again for every single location. So rinse and repeat. And then depending on how big your network organization or seed is, you will then see like a kind of organizational chart breakdown, if you like. So you can see here we have the proprietary limited legal entity name, and then all the different locations or services under that corporate entity here listed. So the location is indicated by very familiar marker, map marker, and then you have the service identified. You can see it is an example of general practice, Lakes Entrance, and then you've got the two different types of services. So this is vaccine clinic, as well as urinary tract infection treatment service. So they specified specific services under that practice. Those options are available to you. All right, now, in terms of editing your details, we'll go into this in a second, but this is where once you go into that business at that level, you can see here, there's a breadcrumb at the top. This will always tell you where you are in the organizational hierarchy. So Face Value Dental is a business that's associated with the parent company. And so that's how you navigate through the system. So we're here under Face Dental, and then you can see here under the 5 tabs, this is where we confirm who our partner services for. This is where we publish to other services, which we'll address in a bit more detail. And this is where we manage location details, healthcare services, users, etc., etc. So we click on location details and then manage organization, change. All right, so add location. So if you're not registered on the NHSD and you need to set up a site, this is where you would go instead. So you can ignore this if you're not on the NHSD and click here instead. And you go through the whole details, you walk through the form, and you can add the location underneath. And this is what I meant by the WYSIWYG editor. So it's going to prompt you through all of these steps. It's going to show you amber, red from the beginning, and then go through green once you complete each one. You can see there's the journey. We've got locations, services, practitioners. Just think of those 3 things: location, services, practitioners. So the parent, the overarching parent, of course, is the legal entity name registered on the ABR. And then you have locations. Then you have the service that's under that location, and then the practitioners that sit at that location. So follow the prompts, and this is where you can now add locations. So you can see here we've got details. We can add location under that company, right? And you can see where we've added all the different types. So same name, Peter Polly Dental, Peter Polly Dental, Launceston, Ryde, Eaglemont, Brisbane, etc., etc., etc. And that's how you structure
the hierarchy under that parent company. You can see here the organisation A Ceramics has registered the following location, so it clarifies. And by the way, as you manage each one, if unfortunately one of these locations cease operating, then you would simply come in here and change it from active to inactive. So going through the details of a location is just like filling out any web form. Follow the prompts, enter the name, also known as, there could be another name it's known by. So again, this is stuff you would have skipped if you were already registered with the National Health Services Director. You would have imported all this. It's super fast, so it speeds up all of this entering of data that you have to do from the get-go. So, but if you're not on the NHSD, you're going to have to follow the prompts in this section. So we want to add the location type. So physical location, for example. You can also have, if you know, and we as PHNs have a lot of businesses that are already registering and publishing to us that are online only telehealth services, for example. And so they don't have a physical location; they are online operators only, and that's a distinction. So add all the details, contact details previously entered. So it's a rinse and repeat. It can be a bit frustrating at times that you're repeating yourself. But again, if you're not on the NHSD, once you do this once, you're not going to have to do it again. Just think of it as a one-off exercise to get the bulk of it in there, and then you're only having to manage it from then on. So now we're going to add the healthcare service under that location. Right? We're going to manage the business. Select the parent business, and then add healthcare services. We're going to add the details. So search, this is just a quick search. There's a predefined list. So again, it's not free text. You start typing and it'll bring up the list. So if you type in start typing general, it's going to come up with general practice, for example. Physiotherapy, it'll come up with physiotherapy. So just select the one that's relevant. And then the service description here. So this is, notice it says here, the following description will display to the general public. To include key information about the service that is not included elsewhere. So this is a chance for you. You've only got 500 characters, right, to utilize here, but this is your opportunity to put as much relevant information for general public about who you are, the services that you offer, especially if you have any unique service offerings in the healthcare space, for example, or certain features about the location, special disabled parking, access to toilets, that kind of thing. Now, service operation dates. So start date, obviously end date, you're going to leave blank because the assumption is you're still open and operating. So start date, look, I wouldn't be too detailed on this one. Around about, pick the start of the month if you're not sure the exact date, as close as you possibly can. Now, this is important, other languages. So if you are in a location where a lot of your customers, patients are bilingual, multilingual, they have you have interpretation services, or more importantly, some of your GPs are bilingual, they can speak more than just English, then feel free to advertise that here. That could be very relevant to people in your community. If English is a second language and they're struggling, knowing that they got someone that could speak their local language, it can be advertised here. Billing options. So again, are you bulk billed or are you mixed billing? So clarify that here. Must you take appointments? Then you can go yes, no. And are you accepting new patients? So as a general practice in your area, are you still accepting new patients or are you not? Are your books closed? Any other restrictions? One thing I might just mention here very quickly to all of the services out there providing mental health services, for example, there's now added the initial assessment and referral levels of care. So it's the nationwide IIR levels of care, so 1 through to 5. If you want to advertise and make known to referring GPs and that kind of thing, then this is an area where you can, especially PHNs, right? We want to know what level of service you can provide in that space, then indicating here what levels of care you can provide as part of your service offering really helps raise awareness and identify any gaps in our communities, for example.
Okay, coverage area. I might just mention this quickly. So service coverage area. Now, if you don't want to specify, you can leave it as is. You can just do generic Australia-wide, especially if you do telehealth services, right? Online telehealth Australia-wide. But if your physical location is in a small, say, potentially rural, remote town, and then by clicking on this, you can indicate the postcode level breakdown, and you can have control as to your coverage area at a postcode level. Now, again, postal address, it's a start typing and then look for the drop down, same as before. You can specify your operating hours. So weekend, after hours, public holidays, break it all down. Just make sure you put the specific times. You might notice as you experience when you fill this out, you're going to have to specify 8 a.m., 0800, then you're going to type in AM and then move on. It'll prompt you if you're missing the data, essentially. Any special operating hours. So again, that's mainly your after hours. If you do after hours services, it's a good idea to communicate that. And then referral details. So this is for both public and practitioners. So you notice it says here, enter referral instructions for both. And again, a good place to advertise secure messaging systems identifiers. So HealthLink EDI should be communicated here. Make it very clear, special instructions. We do not share information using unsecure tools. So you can specify a specific secure messaging platform that you prefer to use, or secure email with password encryption is preferred. Make sure those instructions are very clear to the recipient receiving this information being shared. Again, this will pop up. Does it look familiar with as before? It's the exact same. So again, defaults and then add healthcare service. Automatically publishes that now to the Health Direct online directory. So now let's communicate those with the HPIIs who are located at that particular location delivering the service. Let's add them next. So go back to that homepage in PCA, and then you can click on practitioners and manage. So you can select all the organizations, but up the top right, you simply add practitioner and follow the prompts. Again, simple 5-step process. So is the practitioner AHPRA registered? Yes or no? If yes, you're going to have to enter their AHPRA number, and then last name, first name, and select profession, and then it does a search. Notice how it says search. So again, remember I said earlier at the introduction, there's that connection of PCA to AHPRA system. So it's doing a direct search. Okay, and we'll confirm that, yes, we have this AHPRA number on record and it belongs to this particular practitioner. So you simply check the box and click next. And now you're going to say, so this is you effectively saying that Dr. John Smith, who's a general practitioner, actually works for our business at this location, and he's responsible for general practice services, for example. And then we get into a bit more details regarding the availability of that practitioner. So when did they start? And again, they're still operating, so you leave the end date blank. Enter number of days, so are they part-time, full-time, that kind of thing, the role, etc. And then once you've finished completing all that, you will have that particular, it'll confirm that the practitioner has been added. You can add another one. So if you've got multiple practitioners, it probably shouldn't take you any more than 5-10 minutes to complete all the practitioner information. So now we're going to talk about, once you've done location, once you've done service, once you've done practitioner, those three things, you're now ready to think about, okay, I've got all this information in PCA, I've consolidated it, validated it. Now, who am I going to share it with? Right? How many organizations are out there that we can share with? Now, again, back to your navigation homepage in PCA, you're going to click on Publish Settings, so Manage. And a couple of things to think about here is you want to think about your organization. So select where to manage publications from. So we're going to go, you can do it from the organization level. And then
you click on the Publish to Partner Service. It's a bit hidden because people think to look at the top here and go edit. People think, oh, I need to edit the details. Well, no, that's the edit for the organization in PCA. What we want to do specifically under this tab, Partner Services, is just look for this button on the far right here. Now, by the way, before you do click, you'll notice here down below that you're already publishing to these two, because we did that earlier with your setup of location and service. So now you want to think, who else am I going to share this information with? And you come up with, again, very familiar interface. So 1 to 5. We're gonna search for who's available in PCA as business partners. Okay, so they're people you do business with, vital for sharing. Now, obviously, primary health networks, so pretty much all the primary health networks in Australia are registered as business partners. So we're advertising. We're saying to you, hey, we're here. We're choosing, and I can say from the outset that Western New South Wales PHN, we choose to share information through PCA because it's safe and secure. It's set and forget. Okay, so we actively advertise in here that we collect the information once you share it with us. And so you can simply type in Western New South Wales, and you notice here select a category. So you've got different categories to refine that search, and you can find that particular PHN. Now, other business partners that are on there right now, and for Western and Far West New South Wales, highly recommend you publish to New South Wales Health. Again, they're looking to PCA and the NHSD to validate and synchronize information within their internal directory to link up with all their EMR systems. So I would highly recommend New South Wales Health. Think about all the secure messaging vendors that are out there, any other providers like Telstra Health is on there as well. So if you use any Telstra Health tools, Consult Med will be one of them on soon. So look for all and any business partner that you do actively do business with that you think sharing our information will be relevant for doing business with. And it's going to ask you to accept and proceed once you've selected. Now, each business partner will promote and advertise use policy. So we'll tell you how we're going to use the information you publish to us. So take the time to read that, and as you progress, it's going to confirm here that you're also publishing the service, the organisation, the location, and also the practitioners. Notice how it default to those tick boxes, that you're also letting them know that this doctor works at this practice under our business, our ABN. Once you've gone through all that, you can then move on to publish now. And then you get confirmation that you successfully shared that information with this PHN, for example. And so you only need to do this once. Once you've done this, you don't need to do this again, unless you want to unsubscribe, for example, and go back and remove it. But once you've done this, now when you manage your information and things change, like when new practitioners come and go, or you change locations or add another service, then we'll automatically get that information from you. And that brings us to an end of the step-by-step registration and use. So I'm going to, before I fully open to questions, I'll just finish by simply saying that, of course, help is always on hand. Now, if you're part of a network organization, a bit of a complex structure, there's a lot of locations, a lot of services to take care of, and you're not quite sure how to go about it, then you can certainly reach out to the PHN. But of course, the Australian Digital Health Agency have a dedicated team. There is a very, very helpful team based there that can support you, and in particular, Provider Connect Australia have a dedicated phone line. So I'll just leave this up on the screen for a second, and email, and there's the web address, of course, you can go to for lots of resources, step-by-step guides, covering a lot of the stuff we've covered tonight as well. And there's obviously further services and supports available to you, well, especially if you're interested in the HI service details, how to manage and set up your digital ID, which supports your setup of an individual Proda account, that kind of thing.
There's lots of information out there at Services Australia website as well. This is a handy reference here, the phone number 1800 and option 1 if you need Proto support in particular. And of course, don't forget, we value your feedback on these webinars and information education sessions. Sorry. So please scan the QR code, complete the form. We'd love to hear your thoughts on tonight's event, and move over to my colleague Lisa, and to see if there's any questions at all that have been raised, or maybe you have a curly one for me.
No questions, Brenton, but I guess probably a good thing to raise too is that we also have some really simple instructions on our website. We've developed a digital health toolkit. It's a 2-pager, which makes it quite easy to sort of review and go through that step by step to connect to PCA. And also
Absolutely.
just another point too, if anyone's interested in learning more about business partners, or if anyone has any suggestions about the business partners that they feel most valuable to them, please feel free to contact us and feed it back to us, because we sort of feed that back to the agency, and that helps towards connecting those business partners and bringing more on board and making this a much sort of more holistic experience with more providers.
Yeah, good. And just as an extension to that point, Lisa, it's also worth mentioning that Lisa and I are currently working with the Australian Digital Health Agency this year. We have a contract to feedback some important information, and so we're gathering some information from general practices at the moment as we help them navigate, register and publish information on PCA on business partners that they would like to share information with, but perhaps aren't on PCA at the moment. So please reach out to the both of us directly. You can flick us an email if you've got any particular feedback regarding your user experience, but more importantly, listen, I do business with XYZ. They're not, I can't find them. Would highly value that they're registered on here. And we've had some interesting discussions already. I know one GP who does a lot of work with aged care facilities straight away said it'd be great if the local aged care facilities on there we can publish and share information with. But I guess the usual suspects are things like local pathology, radiology providers and labs are not on there at the moment. And so if you would like to see them, see some value of them, some of the secure messaging providers, software providers, anyone like that. So sharing that information with us will be quite valuable. So I highly recommend you if you don't hear from us that is directly, feel free to let us know as you experience PCA. If you think there should be some improvement. One of the things you may note if you are registered is the agency undertake, it's probably about 2 updates a year. So they have quite a robust development pipeline where they're always making improvements to the system. And usually around, I can't remember the months, but around October and around this time each year, April, May, they do big updates. And so that's why it's highly recommended you regularly log in, check the information, manage it as it changes. And you may find some things getting added. And Lisa and I will try and update you when things change like that during our download series on when things change, how it may affect your use of the platform, stuff like that. Yeah. I'll stop sharing that now. Okay, great. Well, if there are no questions, anything in the chat, then I think we can call that a night.
Sorry, there's just one other thing. I think Russ has just mentioned that HealthLink would be a valuable business partner.
Absolutely. Yeah. And funny, Russ, we had a little digital health leaders meeting with other PHNs today, and we had the HealthLink team come in, and they did actually clarify that they're working to attach themselves, which is great news, but probably part of what's called a phase 2 rollout. So the next 1 to 3 years, they'll be joining in partnership with the platform. So it's happening behind the scenes. I think the big message here, especially for general practice at the moment,
is the general practitioners are in the best position to get the most out of PCA right now, and highly encourage you to get on, start thinking of it as a very useful source of truth tool, and then as business partners come and the platform evolves, then your experience can only get better. Yeah. So thank you, Russ. Good night, and thank you for your time.
Thank you.